In this webinar, we will learn the supportive care of a newborn on CPAP. Supportive care of a newborn on CPAP includes ongoing assessment of the newborn, nasal interface and the CPAP machine, and also ensuring early and aggressive enteral feeding. Assessment is ongoing, systematic, thorough and meticulous. Vitals need to be assessed every 2 to 3 hours, and complete assessment of infant, interface and CPAP system should be done every shift or every 4 to 6 hours. Infant monitoring should include vitals, assessment of all the organ systems. Also, one need to assess the adequacy of FiO2, CPAP and flow in each shift. Respiratory monitoring should include assessment of respiratory rate, recessions, chest movements, breath sounds and bubble sounds. An objective assessment of Silverman-Anderson score is very essential, at least in each shift. Infants in any position need to be properly supported by rolls. Repositioning should be done every 3 to 6 hours, promote nesting and avoid excess flexion, extension, rotation of the head and neck. Airway monitoring includes assessment of secretions in the nose and mouth. Suctioning is recommended only when it is required. When the secretions are thick, moisten the nares with normal saline or sterile water. Ensure the prongs are fit snugly into the nares. Watch for symmetry of nose, blanching of the skin and any skin breakdown. Ensure distance between the columella and nasal prongs. The cap should cover the ears and fit snugly. Watch for twisting of the nasal interface if any. Blanch the tip of the nose and assess for perfusion integrity. Watch for color, perfusion, area of pressure points and areas of skin excoriation. Monitoring of the CPAP system includes recording of the CPAP pressure, FiO2 and flow rate. Bubble chamber should be monitored for bubbling and the water level. Humidifier set in the invasive mode, set temperature of 37 degrees Celsius on the humidifier, adequate water in the chamber, no condensation in the inspiratory limb and some condensation in the expiratory limb are proof of good and adequate humidification. All newborns on CPAP should be fed provided there is no obvious contraindication such as necrotizing enterocolitis or hemodynamic instability. To prevent CPAP belly as shown in the figure, ensure insertion of a orogastric tube immediately after initiating CPAP and keeping the OG tube above the level of stomach and keeping it open most of the times. So, to summarize, monitoring of the infant's interface and CPAP system are essential component of monitoring of a newborn on CPAP. Respiratory monitoring is needed to assess efficacy of CPAP and also for early identification of possible complications. Feeding a newborn on CPAP with orogastric tube and prevention of CPAP belly improves the overall success of CPAP. Thank you.